Welcome to Horse Tales and Wives' Tales, a video podcast that dispels the horse tales and wives' tales common in the horse world while bringing education and knowledge to the horse owner. Your host is Chuck Potter. Chuck is a full-time farrier and inventor of such products as the Hoof, Cinch, and the Lift, and an educator, taking the time to talk at clinics and gatherings on hoof care and horse health. In this episode, Chuck talks about Laminitis and Founder.
Hi, I'm Chuck Potter with Horse Tales and Wives' Tales. This is episode number 3, and today we're going to talk about Founder. First thing we're going to cover is the definition of Laminitis and Founder. The difference between the two. A lot of people want to transpose or use the wrong term for what's actually happening. Laminitis is pain of the lamini. The traditional term is the swelling or inflammation of the lamini, but we're not actually sure that that's what's happening to the lamini during laminitis. There's several different theories out there I won't go into, but there's pain in the lamini. So laminitis is just pain of the lamini for now. Founder is a nautical term for the foundering of a ship or sinking, and that's basically what happens to the coffin bone. It's starting to sink. It pulls away from the hoof wall, and the lamini get stretched in there. They don't actually just let go, but as the bone rotates away from the hoof wall, so if you have the bone against the hoof wall and it rotates down and away, the lamini go from this and they pull out, and they don't just let go. They're still attached in there. There's still blood flow in this region. The things that you're going to see on your horse during laminitis, if you catch it in the early stages before we get to Founder, is they might walk really stiff-legged. It'll look like maybe there might be something else wrong, like their carpals are hurting, or they're having pain in the fetlock, because they'll walk almost like a robot and the front legs will stay stiff. When they do stop and stand, you'll notice that they're going to transfer more weight to their back end, so their back feet are going to come forward, so they're more underneath the horse, and their front feet may go out in front of them, so that they have less weight actually on the front feet. And when they're walking, and especially in a turn, so if you have the horse turn to the left or to the right, you'll see them really drop back on their rear end and try to keep from getting too much pressure on the front end as they paddle, turn around. They could start to lay down more. You might have never even seen your horse lay down, and you'll see them just laying there not wanting to get up. When you see any of these signs, you need to call your farrier and veterinarian right away. You should have a team work on your horse. One without the other, you may not successfully help your horse. You need both. The reason being is the underlying cause for the founder. What causes a horse to founder? Okay, has to be stopped before you can fix the mechanical part of the founder. So if we get into you're only able to get one or the other to show up, you're probably going to want your veterinarian first, because the underlying cause is very important to figure out. Most cases of founder that we find are normally a metabolic issue with the horse. So it could be equine metabolic syndrome, could be Cushing's, the PPID. There's several things that can happen, and what the vet is going to check for, and what you need to make sure is getting checked, is the ACTH levels of your horse, which is the hormone produced by the pituitary gland. The insulin levels. Now this is the actual insulin in the blood. It's not the blood sugar levels. We actually want the insulin levels checked. And we also like to check the thyroid level. Now, we know that the thyroid can't cause a horse to founder. They've actually removed them from horses, And during that testing, none of those horses foundered. But your horses will feel very poorly, and they can recover faster if they feel better. So we normally check that, and we find most of them to be low, and we'll put them on thyroidal. For the ACTH or the insulin levels, we found that using the drug Presend or Pergolide actually helps the horse to get turned around very quickly. I know what Cornell University has to say, that if the ACTH is normal and the insulin level is slightly elevated or elevated, that Presend is not recommended. It's not how they do things, but we've actually found that this does help the horse very quickly to go ahead and give them that Presend on a very small dose, and it will help get their insulin level back down and make the horse turn around and feel better. You as a horse owner, when you see your horse go into this, right after you make that phone call to your farrier, your veterinarian, you got them coming, what you want to do is remove all possible sources that could have caused your horse to founder, okay? So if you're lucky and you actually know what it is, if it was something to do like he broke out and broke into the cattle's feed bin, he got loose and broke into the big pasture of nice green grass, whatever. If you can remove him from that and get him into an area where all he has available at that moment is just water to drink and just dry grass hay, no alfalfas, no mineral blocks, no nothing else, you'll have a better chance of stopping damage at this point. If you don't have the capabilities to move your horse from, like if he's in a big pasture of green grass and he's laying down and you notice that all the grass around your horse is missing because he's just been laying there eating, you're going to want to get a muzzle on him. If you have to make one out of a t-shirt or whatever, they make nice good muzzles for the horse that you can attach right to them, or you can put it on their halter. This will keep them from eating more grass. Once you're able to get him out of that environment, get him to another area, you can take the muzzle off of the horse. Once you've got that done, you really don't want to do anything else to the horse's foot itself as an owner. If you're real comfortable with the horse, and you have a sand area to put the horse in, that's probably your best option, is to put him in the sand, because then the horse can actually move his feet into position where he feels more comfortable. And a lot of the horses that I take in that we do rehabilitation on, that people were going to put down, we actually take them. The places I take these horses to have beautiful sand indoor arenas. And so we're able to let the horse go in there and walk and move while we're fixing them. Hi, I'm Chuck Potter, inventor of the Hoof Cinch, and I'm here with my new product, the Lift. If you have a horse suffering from navicular syndrome, you know how much pain they're in. So I designed an effective, therapeutic way to end rear hoof pain.
I'm Dr. Jan Daly, and I'm excited to say that not only will the Lift eliminate the painful effects of navicular syndrome, but you can see results in as little as 15 to 30 days.
It's pain-free, cost-effective, and most importantly, it works. With the Lift, you'll see your horse rise above the pain. I'm going to show you what Founder looks like internally here on there. Okay, you can see that there's not a dead space between the hoof wall and the bone in here. And so you can see that the laminae don't just disappear. They actually just stretch out in the front of the foot. And looking at this horse too, you can see the hoof capsule is slightly distorted in here as well. And that tends to happen when you have a horse that founders and they're foundered for a while and they stay on a hard surface. You'll start getting a lot of this distortion in the front of the hoof wall. And normally when the farrier gets there, he'll want to take all that off, especially once you see the x-ray, you see where the bone's at, and you'll know how much of the dead material on the front of the foot can be taken. We still want to try to make the front of the foot from the coronary mound to the toe area a straight line. And that, so we shouldn't leave the distortion on here. So in other words, when the farrier comes, you'll be able to cut this off straight down from here to here. Cut that right off. There's no live tissue in that area. It's all dead material. And by taking that off, you have less of a chance of having bacteria get into this dead material and causing abscessing in the front of the foot that can further cause more damage to the lamini and to the coffin bone itself. Okay, now we're going to cover the treatment of founder, and there's a couple of variables involved when the farrier shows up to what he's going to do. Is one, can the horse get up? Can he lift his feet? How much pain the horse is actually in, and it'll have a lot to do with what we can get done initially for the horse. If he's in so much pain that he can't pick up a foot, okay, the horse is standing, normally what we'll do at this point is go ahead and get the hoof cinches placed onto the horse's feet. Sometimes as soon as I put the cinch on one foot, I can then pick up the other foot, because now by placing a hoof cinch on the foot, we can actually stabilize the hoof capsule so that there's not that flex in it. When the bone rotates away from the hoof wall, the bone turns down, the front of the hoof wall now has more flexibility in it. It doesn't have that bone attachment anymore. Once we rotate, we have more. So what the hoof cinch does, it actually replaces the lost tensile strength in the front of the hoof wall. And I'll show you what it looks like. This is a hoof cinch on a little pony foot. But like I said, what it does is when we screw it onto the sides, we tighten the front here, and it actually stops the front of the hoof wall from being able to flex in and out. Now your heels can still flex as the horse bears weight, but the front of the hoof wall can't flex in and out. And so it stops that pull on the lamini that are in pain, so it helps reduce the pain for the horse. A lot of times, like I said, when I go to the horse, I'll put this on one foot, and then I can go to the other foot and pick it up so that this foot's on the ground with the hoof cinch on it, because we've replaced the tensile strength in the front of the hoof wall. If we can't, still pick up the other foot, and then I'll go ahead and just put both hoof cinches on. We'll get the veterinarian there to get the blood draws, to check for the ACTH levels, the insulin levels, and the thyroid as a starting point, because sometimes there's other things that can cause the founder, some of the tick-borne diseases, and some other issues that we may have to come back and do further blood draws to find out what's causing the horse to founder. Because if you do not stop the cause, you're not going to be able to fix the mechanical part of the founder. It'll just keep happening again and again and again until you stop the process. So we get these on, and like I said, we'll get the blood draw. If it's, say, the horse has got high ACTH and insulin levels, the veterinarian will go ahead and get your medication started for you. And within just a few days of starting the medication, having the hoof cinches on, you'll see a very quick turnaround for your horse. Okay. Normally when we go to put the cinch on, even before we stop the cause, you're going to see some kind of pain relief for your horse. Like I said, we talked about earlier a little bit of the stance that you'll see with those back feet underneath the horse, the front feet out in front of them. When I apply the hoof cinches and tighten them, you should see them stand more normally. In other words, the front feet should come back underneath them, the back feet should come back, so that it looks like they're standing normally. Now the horse still may not be able to walk very well. It'll still want to reach out and step on the heels first. And once we get the drugs on board to stop the process, then you'll see that change very rapidly. With the hoof cinch, we've treated horses in excess of 30 degrees of rotation, and we're able to bring them back to 0. Now we're not moving the bone, we're moving the hoof wall. As the hoof wall grows down from the coronary band, that would be the soft part just above the hoof wall, we place the tension of the hoof cinch just below that. So we're getting below the extensor process on the coffin bone, and allows the hoof to now grow back towards the bone as it grows downward. And that's how we're able to take the rotation out as the foot grows down. Like I said, we can't move the bone, but I can move the hoof wall, and it allows the lamini to actually reattach, and your horse, as long as it's not like a Cushing's horse or something that will cycle no matter what you do, they can normally go back to doing what they used to do. Now let's say we get there and we're just in the stages of laminitis. The vet got there first, shot the x-rays, there's no rotation, but blood tests should still be drawn. And we see that, okay, it was insulin resistant. A lot of times we'll go ahead and put the hoof cinches on to help stabilize the front of the hoof capsule so those lamini aren't being pulled as the horse walks, and you'll see them turn around very quickly. The other case is if we have a severe amount of rotation, or we have huge amounts of, like the ACTH is really high, the insulin level is extremely high, we'll go ahead and elevate the heels on the horse. Now there's a couple different ways we can do this. We can either do it by trimming, in other words, trim, I'll show you on this one here. In other words, you trim more toe area to bring the angle up on the horse, or we can apply a mechanical device, a wedge shoe, a wedge pad, and they can glue on, nail on, whatever the horse can take. I like to nail the shoes on, but I have used the glue-ons as well. The reason that we want to elevate the heel is what we're trying to do is release the pull of this deep digital flexor tendon that runs down the back of the leg here. It goes under the navicular bone and hooks onto the bottom of the coffin bone. Okay. If you cut the heels off the horse, you're actually increasing the pull of that deep flexor on there. So you already have a failed system in the front of the foot. The lamini have failed. And then you increase pressure on the back by cutting the heels. You're going to create more damage in the foot by doing that. So we actually want to elevate the heels to release the pull of the deep digital flexor in the rear of the foot. Depending on the severity, it'll depend on how much lift you're going to want to do, and that's your farrier's job, is to determine how much lift to give the horse. We normally go with at least a 2.5 degree wedge shoe plus about a 3 or 4 degree wedge pad in there, and not a complete pad because I want to leave the bottom of the foot open because we don't want abscesses in there, so we normally use an open-toed wedge pad. We just decrease that pull, and then those shoes don't have to stay on for the whole time. Once we get the horse comfortable and that we get to the first trim in about 6 to 7 weeks in, then we can take those shoes off and evaluate at that time if we need to put them back on or not.
The Hoof Cinch treats Founder from a whole new angle.
It just forces that new growth along the bone, and it actually reattaches.
Unlike conventional Founder treatments, the Hoof Cinch is applied to the outer hoof wall. It stabilizes the capsule and reduces pain immediately. In 12 to 16 weeks, horses can return to whatever they did before. Get the full story and watch a short video at hoofcinch.com. Don't give up on your foundered horse. Take the first step and learn about the Hoof Cinch at hoofcinch.com.
Okay, then a couple of the things that you definitely don't ever want to see happen to your foundered horse when the farrier gets there. And there's things that we're actually showing now that can cause more damage to your horse. Like I said, cutting the heels off of your foundered horse because you're trying to put weight onto the frog of the foot. In other words, chop these heels, get the frog on the ground because you think you're supporting the bony column. That's not how things work. Okay, if you do that, you're actually, like I said, increasing the pull of the deep flexor, and you're going to cause more damage in the front. And the solar corium in the bottom of the foot, where all the blood vessels and everything, you're going to push that coffin bone just deeper into them, and you're just going to cause more discomfort. A reverse shoe is never good for a foundered horse. Okay, I know I've heard people say, "Oh, I use the reverse shoe; it works great on foundered horses," but that's because if you didn't do anything, that horse would have survived just fine. And in other words, maybe didn't do x-rays, probably not even foundered. Now reverse shoe on, hey, look, he's doing good. Well, it's not reverse shoes actually cause more damage in the front of the foot. When a horse stands, you have his weight divided, and we're, just for sake of argument, we're going to divide him into quarters, okay? We're not going to say there's 60% weight in the front, 40 in the back. Just say we're even all the way around, so 25% of the weight at each leg. And so you have 25% of the weight coming down the leg, but because of how the bony column of the horse's leg is, the foot is in front of the bony column, very slightly. And because of that angle, depending on what angle the foot is trimmed to, you're normally about 15% more forces on the foot itself than the weight coming down. Okay? The lower you cut the heels on the horse's foot, the greater those forces become on the foot. In other words, you're going to drop the ankles back, foot goes out in front of the horse. You actually create more forces on the foot. Now you have different forces. You have the actual weight of the horse coming down. You have ground forces coming up. And then you have the friction force of the hoof as it hits the ground to hold it in place so it's not slipping forward. And by lowering the angles, you increase all of those forces on the foot. And by putting a reverse shoe on, you've now, let's say the hoof wall, let's say it's a circle, okay? And you take part of that circle away in the front of the foot, now you've increased the forces in the actual toe area on the internal structures in that, because I know what people are thinking. They're trying to say, well, we're moving the weight to the back of the foot. And this is true until you consider the fanning forces of the internal structures, okay? The way in engineering, when you have forces coming down and you take part of a bottom circle away, the internal structures have a fanning force, and they actually increase where you don't have weight-bearing distribution on the circle. So you do create more problems by putting a reverse shoe on a foundered horse. The other one that I hate more than anything, this is just personal for me, is the rocker shoe. And the reason being is you have destabilized internal structures on a foundered horse. Okay, the front, those lamini have failed in the foot. So you've got this bone in here that can now move like this. Okay, now you're going to take and put a rocker on the bottom of that, so you have a destabilized bottom structure. So the horse can't figure out how to stand comfortably. Okay, so he's constantly having to fire muscles up in the top part of his leg to try to keep his foot stabilized. And so you have two destabilized structures now, internally and externally. There's no way that can help your horse. So the best thing to do, 90% of the foundered horses I do stay barefoot, as long as I can trim the angles up in there to decrease the pull of the deep flexor. If we can't, then I'll put a shoe on, like I said, nail or glue, raise the heels up, decrease the pull, and then stabilize the front of the hoof capsule with the hoof cinch. All right, today's wives' tale we're going to cover is that founder can't be fixed. Okay, with the hoof cinch now we can actually fix the founder. We can take a horse from 30 degrees back to 0 degrees, or from 10 back to 0, whatever the rotation is. We can bring that hoof wall back to the bone, reattach, and that horse can go back to doing what it used to do. We have fixed barrel racing horses that are now competing, reining horses, show jumpers, trail ridden horses, everything in here, and all of them have been able to go back to doing what they used to do. So founder is fixable. I'm Chuck. This has been episode 3. If you have any questions, go ahead and email us at podcast@hoofcinch.com, and we'll go ahead and try to get those questions answered for you. Thanks.